Anyone?
It's from irrational thinking into rational thinking.
Well, it's correct thinking, accurate thinking, right? It's what we mean, accurate thinking. It's not positive thinking, rational thinking, irrational. Sounds a bit of jargony, but what it is accurate thinking, right? So I have a patient, for example, who thinks that he is a wolf man. He can go put his leg against a car, the heat exhaust pipe, and he'll be fine. But then he burned himself. So that is not accurate thinking. That is what you call irrational thinking. It's true, right? So someone can think that if they go in front and give a talk, everyone would laugh at them, and that would make people will think that they perform terrible, they will have a panic attack. Again, that might not be an accurate thinking, right? So that is perceived thinking about threats that is not realistic. So the goal of CBT, therefore, is to help the patient to first of all identify the inaccurate thinking and to come up with the accurate thinking, so that we have an accurate story to tell ourselves, so that we don't have this perceived threat is more than the perceived resources, right? So CBT, yes, is one of the most effective evidence-based type of therapy. Of course, it is cannot be done overnight. You will need to have a few sessions to teach the patient, but it's relatively short number of sessions to identify the inaccurate thinking first of all, and then to replace by the accurate thinking, right? So this is why CBT helps. What other the technique did you mention, Kausini? I forgot, apart from CBT.
Medication,
you were saying
medication or mindfulness.
All right, okay. All right, let's talk about this too. Medication, of course, will be referring to psychiatric medication. All right, so we do have psychiatric medication as well as psychonutritional medication. Right, I'm not a psychiatrist. We have psychiatrists in IPC, that can prescribe medication. We leave it to patient to choose. And medication can be effective, but like I said, research has shown that CBT is as effective as medication, right? They do something called outcome study, right? Outcome study means that there are two groups of subjects, right, with very similar diagnosis, okay, similar everything, right? Man, woman, age is all like randomized, right? Very similar, same level of panic attack. And one group you have medication, and then one group you have CBT, and then the outcome would show that the same reversal, right, is affordable to both. It's the same, but with a difference, right? The difference is that the group going through CBT has longer, more long-term benefit. That means the reversal of the panic attack stay, right, with them even after finishing the CBT. Whereas the medication, guess what?
Repeat.
Yeah, so you stop the medication, the panic attack come back. And why? Why is that? It can easily be understood why the CBT has longer term effect than medication. Why is that?
Because the medications are helping for to calm the patient, not the patient are doing that themselves.
Well, yes, exactly. So in CBT, the patient actually learn a new skill that will stay with them as long as they practice, that they remember the skill will stay with them even though they have stopped seeing the therapist, right? So this is like any other skill, learning to play the football or piano. It will stay with them long after the training. Whereas medication, you stop the medication, your serotonin spike will come back down, for example. So that is the difference. So that both are as same effectiveness, but then the psychotherapy would have a longer term effect. So we're not saying don't use medication, for very extreme cases, but you should always consider having psychotherapy as well, like CBT. Mindfulness is another one, that is derived from practices of Buddhism, right? We have also courses in this, and that is also shown to be effective, where you still your mind and you focus on things rather than being distracted by all the stressful negative thoughts, right? So that answer your question about medication. Of course, we can even go deeper into medication, the difference between medication and what we call the psychonutritional medication, right? So medication like SSRI is a very common one, selective serotonin reuptake inhibitor, which means you block the breakdown of serotonin, you end up having more serotonin. But the problem of that is a lot of neurotransmitters use the same transporters. So if you have a lot of serotonin, and this is the work of Marty Hinz, and you can Google him up, and Lawana, you can type in his name, Dr. Marty Hinz, Hinz, right? He's a lot of peer-reviewed research paper on this publication, comparing medication in what they call psychonutritional medicine, right? So the problem with medication is that the side effect is due to blocking the other neurotransmitters, right? So when you have a lot of serotonin, it blocks the dopamine, it blocks your other neurotransmitter, and then you end up having the same problem, right? So in psychonutritional medication, we supply the precursor, so your brain would not have too much serotonin. You only use like tryptophan, for example, 5-HTP. This is a precursor of serotonin, right? And then maybe you can share the book Lawana, the energy, brain energy by Dr. Christopher Palmer, and also the Vanita Dahir, Alchemy of the Mind, which talk about all these neurotransmitters and things. So the brain has a lot of chemicals called neurotransmitters. When you have too much of the excitatory one, you get panic, right? You have deficient of the calming one, like GABA, serotonin, then you panic. You have too much adrenaline, no adrenaline, even dopamine, you panic, right? So we at IPC we have a urine test to test of this as well, right? So that is the side effect of medication. You block out, with a single neurotransmitter like serotonin, you block out all the others. So a better strategy, if you want to use medication route, would be psychonutritional medication, which we also have courses to teach you based on the work of Marty Hinz, right? Which we supply the precursor. All right. Why do someone need a precursor like tryptophan? 5-HTP is a precursor to serotonin, right? Tryptophan, for example, you can get it from chicken, turkey, even pork, right? For those who eat pork. But it might not be because you don't have enough of this food, right? So you might still eat enough of this food, but then you might still be lacking, right? Because of conversion problem or whatnot. So this is called relative nutritional deficiency. All right. So all these are physical routes, which will not elaborate much more, but just to give you a quick intro, right? We are, I think today we want to look more into the psychological side of things. So I hope that answers your question on medication, the role of medication, and as well as various form of psychotherapy, Kaushini. Yes. Okay. So to talk about lifestyle, we need to talk about something called stress hormone, right? So we already mentioned adrenaline, noradrenaline. These are stress neurotransmitters linked to stress hormone for cortisol. All right. So our lifestyle would determine our cortisol level. Okay, so if you have a stressed out mother, for example, it would give rise to a baby during conception, of course. That is easily panicking, right? So it will pass down. That might even have a lower IQ. So stress, that the physical effect of stress uh, has a this physical correlates, right? So there are a number of lifestyle uh, interventions that can lead to more stress or less stress. That the biggest one, of course, is sleep, right? We just come back. Tommy and I did this morning from a talk about helping people to have a good sleep. So having enough sleep, for an adult, 8 hours, 7 to 9 hours is good, right? To have the right type of diet. Diet is one big thing. Like for example, I'm on a keto diet, the OMA 1 meal a day diet. For now, I'm very calm and I haven't even eaten my breakfast yet, right? How does that happen? It is because I am not at the mercy of sugar spike, right? So a lot of people are on this yo-yo diet. Your when you're hungry, your cortisol like plummeted, or your cortisol would increase when you're hungry, and you would then easily panic and fearful. Whereas I'm on a steady ketone. I'm using all my body ketosis. I'm not hungry. I'm calm, right? So because so that is lifestyle, right? So we're not going to elaborate on this, but for those interested, we have courses in nutritional therapy. But check out ketogenic diet and Lavana. Again, the book by the Christopher Palmer, although he's a psychiatrist, to talk about the ketogenic diet. Okay, so yes, lifestyle. One good practice I practice is grounding. Right, in the first thing in the morning. Like this morning, I just go out, hydrate myself. So that is a very look at nature. That would be very calming, right, and give you the resources. Of course, there are the various more specialized type of practices one can do in terms of lifestyle, like a type of meditation you can do, and we have a specific meditation like you mentioned mindfulness, right? But we have one where you can check in with your various selves. All right, so we have a different selves, and I believe Lava, you should have this book, Embracing Ourselves, which is the first book you read when you come here. Show that book, please. All right. So this is a book by Houston, which who was a Jungian analyst, and the idea is that we have different selves, right? We have a self that are confident, we have a self that is fearful, right? We have a self that is vulnerable. So this meditation involved in checking with each of the self. So say you have a co-host event this afternoon. So when you wake up, you check in. How's my vulnerable self doing? How's my fearful self? I may even have a panicky self. How's that doing? Well, it's more like a vulnerable self, right? My vulnerable self, how is that doing? And then tell her or him that your resourceful self is there. I got your back. All right. So these are all nice psychological lifestyle practices you can do as well. Okay, you found my book. Fantastic. Lava. Embracing Ourselves by Houston. And I learned this technique from his daughter, Tama Stone. Right. So this is the Jungian type of therapy called voice dialogue, which we also have in the course as well. Very useful. Right. I think that's a lot in terms of lifestyle changes. We can practice good lifestyle change, good lifestyle that would help us, and of course, work-life balance. We don't want to be right having what we call the unrelenting standard type of schema. Trying to do everything perfectly, which will also lead to a panic. Right. So maybe there's something we can also talk about later, the various schema or psychological program, and Lava, you can try to get hold of some schema card, like vulnerability to harm, right? Card and things like that to prepare us. Yeah.